In today's 2-minute top tip for the 30-day osteoarthritis challenge, I'm going to teach you how to do a deadlift, which does sound pretty scary, but for the purpose of today, we're just going to call it a bend and lift. Okay, so if you want to get better at bending and lifting, make sure you keep watching until the very end. We're going to start right now. If you haven't heard of a deadlift, it is a movement that involves bending and lifting. So if you are struggling because of some knee pain, some hip pain, maybe some back pain, and it's something that you are worried or concerned about, then it is something that you need to practice in order to condition your body to get better at it. So if that does look too hard, let's start right at the beginning and I'll teach you how you can progress things. So the easiest way to do it would be take yourself out of standing. Let's just practice a few in sitting. So we'll start with no weight and we'll just practice bending without any weight at all. So just having a lean forwards, trying to touch your hands on the floor, slowly coming back up. Lean forwards, touch your hands on the floor, and slowly come back up. And if this is a movement that you're not used to doing or you have avoided, it might be that your back is quite tight and stiff and uncomfortable and sensitive. So we're trying to desensitize that area of tissue with these movements. Once you're happy without any weight and you think you can progress on to using some weight, it doesn't matter what you use at home. It could be a rucksack with some heavy books in it or a few bottles of water. If you have weights at home, then great. Pop your weight in front of you, exactly the same movement. You're going to lean forwards, lift your weight up, and then slowly pop it back down again. Lift it back up, and slowly pop it back down again. Once you're happy bending and lifting, sat down on a chair, let's have a try at doing it stood up. Same thing initially. We'll start off with no weight at all. So a little bit of bend in the knee, a little bit of bend in the hip, and then you're just going to lean forwards and come back up. With all of these functional movements, we just start through half the range first and then come back up. As we feel a bit more confident and we get a bit stronger, we can go a little bit lower. So a bit more bend in the knee, a little bit more bend in the hips, and come back up. As you feel more confident, then you start to add some weight. So grab your weight, have it in front of you, and you keep a hold of your weight the whole time. Don't let go of it. So bend in the knee, bend in the hip, aim for chest parallel to the floor, nice straight back. Pick your weight up, drive up through your feet, your knees, and your hips. Once you've got the movement pattern down to a T, and this is a movement pattern that people do struggle with. So a nice way of making sure you are doing it properly is doing it in front of a mirror so you can see exactly what your knees, your hips, and your back are doing. And then once you've got the movement down, it's just a case of gradually progressing the load that you're lifting. If, like me, you enjoy spreading some arthritis positivity and you'd like to get your hands on one of these arthritis inspiration t-shirts, you can find a link to the shop in the description below the video. Question of the day: what weight are you using for your bend and lift or deadlift at home? Let me know in the comment section below the video. If you have enjoyed today's video or you found it helpful, then please do give it a thumbs up. It really helps the channel grow and it helps more people see the content that hopefully you find helpful. And if you are new around here, subscribe so you get notified every time we release new content. And whilst you're doing that, I'll see you in the next one.